So that is what we are talking, because in all the patients, all the lesions are different, very different. So in
Yeah.
every lesion, timing of intervention is different, right? So like left to right lesions, we tend to intervene early, like VSD, PTA,
Hmm.
coarctation, AV canal defects, and truncus. In these lesions, we have to intervene early. Otherwise, cyanotic congenital heart disease, we can wait a little more, maybe 1 year of age. But there are some diseases like TGA and TAPVC, we have to intervene in maybe neonatal age also.
Okay.
Yeah. So
Like
every
during
lesion.
the pregnancy period. Yeah. Okay.
One of the questions was कि every heart disease require surgery,
Surgery. Yeah.
and other question was कि if there is alternative treatment available
Right.
other than surgery. So if they are smaller lesions, if there are smaller lesions like a small VSD or a small ASD, we can leave these lesions. They don't interfere with the general well-being of the patient. They don't interfere with the daily lifestyle of the patient. So we can watch them, we can follow them. So if the lesion is small, we can just see them again and again on regular intervals. These kids, they don't require a surgical or any other intervention if we are following it with the cardiologist. Other thing is, other than surgery, now we have developed in the cath lab, we can do devices to close these holes. We can do ballooning to open the valves. So this field is progressing very fast. So without surgery, we can treat these kids. We can close a VSD, we
Mm-hmm.
can close a PDA, we can close a ASD in the cath lab without any surgery, without any surgical
Right.
scar, and can discharge them early. So this treatment is also available depending upon the indications. There are certain indications for surgery, there are certain indications for device closure. Depending upon that, we can do both the things, and both have excellent results with its own advantages. Surgery has its own advantage, and device closures have its own
Okay.
advantage.
So, I was reading a study published in PubMed, and so there was mentioned that 20% of the CHT cases, they have reasons like exposure to teratogens or, a diabetic mother or something like that. But there are 80% of the cases which we still don't know that why a child is born with CHT. So, how can a parent prevent it from happening? Like one way you said that you do screening test and everything. But other than that, what are the ways?
So
Okay.
most of the diseases, most of the cardiac lesions, they don't have any cause. As you told, that more than
Yeah.
80% of the cardiac disease, they don't have any cause. So it's only the uh, mismanagement in the structural formation of the heart. When the heart is being formed inside the mother, there is
Hmm.
a malformation in that. Okay, and what we can do to prevent that? Obviously, see, there is a small genetic predisposition. If there is a genetic predisposition, we can evaluate it before the pregnancy, or
Hmm.
that if they are predisposed to the congenital heart disease, we should evaluate other sibling if he is having congenital heart disease, then we can evaluate genetically. But this is very small group of patients. Other is we
Okay.
should have healthy diet. We should not take unnecessary drug which can cause
Hmm.
this congenital heart disease, which have small association with congenital heart disease. Other
Hmm.
thing is the mother is diabetic. We can have proper treatment. Any other disease if she is having, then there should be a proper treatment for that. Alcohol, smoking, this should be avoided, and any teratogenic drugs or in the first trimester especially, we should avoid that. Other than that, I don't think we can prevent this congenital heart disease. We can
Hmm.
detect this congenital heart disease in the pregnancy before 20 weeks of pregnancy. Like legal age in India for abortion is nowadays is 24 weeks. If we detect if it is a complex problem, then we can
Hmm.
discuss with the parents. Then we can certainly go for a MTP, and we can only do that. We can see this problem in the pregnancy, and then we can plan accordingly what we should do.
So Sunidhi, I can tell you in bold letters, we don't
Yeah.
know the reason of congenital heart disease in most of the patients. That
Right.
is number one. We can only certainly associate some of the congenital heart disease with some of the things, like some are exposed to the radiation, some are for the drugs, alcohol, or something, smoking, or something like that. Otherwise, in most of the cases, we are not aware till now what is the cause for the congenital heart disease. So I don't
Yeah.
think there is any role of any parents into it, and I don't think they can do anything to stop that. That's all.
Okay.
And only thing they can do is the right time they can do the echo, fetal echo, and to diagnose their problem.
Right. So, see, any disease in general, specifically when they are happening in, small kids, it is very frightening for parents. And when it comes to surgery, it's a very downhill experience for them. And the one question that every parent must ask is, can a child live a normal life after a surgery? So, can you shed some light on that? That how is the life after surgery if a infant is having a surgery? Do they lead a normal life
Yeah.
ahead?
So in that aspect also, in that aspect of surgery and surgical outcome, and about the rest of the life, how child will behave, his child is able to do the exercise, child can play like the normal kids. I think this
Mhm.
all depends on type of lesion. That is number one. Number
Right.
two, right time of surgery, right time of intervention is very, very important. So nowadays, in last 10 years, a lot of practices has been evolved around
Mm.
the timing of intervention. Okay, like atrial septal defect, that is one of the simplest defect. Initially, I used to treat that either maybe device or either with a surgical closure at the age of 4 years. That is
Yeah.
before going to school. But nowadays, I'm closing the ASDs at the age of 2 years. And why it
Oh.
is so? Because I'm closing the ASDs before the heart gets enlarged. Okay.
Hmm.
So once I close the ASD at the age of 2 years and child is okay, a child heart is absolutely normal, like normal kids. Okay. So
Yeah.
like if done at the right time,
Hmm.
operation or intervention, the child in most of the diseases behave like the normal kid. Okay, their life expectancy is normal, their
Okay.
exercise capacity is also like 90% of in
Hmm.
comparison to the normal kids. Okay, only single ventricle situation is one situation that is like till now we are worried about. Yeah, we are aware that they have got some 30, 40, 50 years of life. After that they need some more intervention in terms of cardiac transplant. Their exercise capacity is also little less in comparison
Hmm.
to the normal population. Otherwise, around 90% of the lesions, the kids have got almost normal life expectancy and normal exercise capacity.
So, like, there are a lot of devices around us nowadays. Technology is evolving, phones, laptops. Do they have any impact on a child's health after surgery, like these devices?
I don't think so.
Okay.
Till now, we don't find any association on any risk association with exposure to the laptop and mobiles and all kind of electronic gadgets. I don't think so.
Okay, so yeah, that would be it. That would be the end of this session. It was, really nice interaction with you guys, and I am certainly feeling a lot informed because I had a lot of questions. And yeah, thank you for taking out the time and sitting with us and sharing your expertise with us. And well, I would just like to tell a little bit about us in the end that at Medigens also we
Sure.
have been seeing a lot of incoming cases of CHDs, and we have seen a lot of patients.
Oh,
Parents are coming with them; they are worried about their kids, and one thing that in our experience we have managed to acknowledge is that if timely intervention is done under the care of certified expert doctors just like yourself, the situation can be dealt pretty harmlessly. Like you said, they can lead a healthy life later on.
yeah.
So this is our aim, to make healthcare accessible, to make more and more parents be able to connect with doctors like understand what is going on with their child's health. And I think that this session will help them with the answers. So thank you, Dr. Gaurav,
Definitely.
thank you, Dr.
So
Dinesh.
whenever we talk about heart surgery, everybody has got its own fear. Okay, and especially if we talk in a kid, basically, so they
Yeah.
always have got these doubts because he ये तो भगवान का किया हुआ है. I don't think we are able to correct it. Okay, something
Yeah.
like that. Even if we are able to correct it, how child will live his life after that. Okay, so I think these are the myths we need to take care of that, and I
Yeah.
think we are in that journey. We are with you. Certainly, if any help is required, we always have. Okay, we are
Yeah, and we
always
will
there.
be
Let's
having a lot more sessions with you ahead, so that
certainly.
our audience will know and they'll stay tuned with us for more information like this. Thank you for joining
Right,
us.
Sunil. Thank you. Bye. Take care.
Bye.